Mental health statistics may seem dismal for the general population. They're even worse for providers. PTSD, depression, burnout, and suicide rates among healthcare professions, from MDs to EMT basics, is higher than the general population.
Firefighters are really great at not taking care of themselves, not seeking help when they need it, but doing anything they can to help anybody else. Whether it's someone at their station, someone on the street they don't know, someone inside a burning house, they do anything they can except help themselves. They're the last to say, I need help.
Well, I will tell you that, growing up as a little tiny firefighter and going through the ranks, I was had a paramedic patch for almost 20 years and saw a lot of things. And you see people on their worst days of their lives. They call 911 for a reason. They're not having a good day in most cases. And so you see a lot of terrible things. And at first it was never really broached by the leadership that I had when I first came into the fire service. It was toughen up, you get through it. And I've seen that before, it's not a big deal, move on. And so we didn't develop a lot of those skills, especially positive, skills for resiliency. So we dealt with kind of that transition. I noticed, not only for myself, but seeing friends, colleagues, peers that were abusing themselves because they weren't sure how to deal with such an abnormal event, and realizing a lot of our feelings that we had were actually normal for an abnormal event, but everybody suppressed it.
Reports indicate that retention rates have dropped significantly across the spectrum of essential workers. Today, many hospitals have had to close entire wings due to staffing shortages. And in rural areas, entire hospitals are being forced to close due to provider shortages. This is a complex and often overwhelming challenge, and I don't pretend to have the answers. What we have here is our effort to take a small bite out of this monolithic elephant.
If you don't prepare people the right way to take care of themselves, they will burn out. I know from firsthand experience because I did it. So it's an opportunity to really get people more prepared for what they're going to encounter and how to really take care of themselves and prepare their families in a way to live through and thrive through their careers.
It was not a check the box. It was a change your life.